cancer is a very serious problem in Nigeria. It has common in Nigeria today as it is anywhere in the world. The unfortunate thing is that we haven't got the facilities, enough facilities, and enough manpower to tackle cancer as they are tackled in other parts of the civilized world. That is the problem we have with cancer. The commonest cancer, as it is in every part of the world, is cancer of the female breast, followed by cancer of the cervix. The cervix is the neck of the womb in the woman. Then cancer of the prostate, cancers of the head and neck, cancer of the intestine. Cancers in all parts of the body, you'll see. Even cancers in children, we attend to.
How common is that, cancer in children?
There are some cancers that are actually called childhood cancers because you see them mainly in children. They're very common, almost as common as adult cancers in adults. They are common.
So tell us about the facilities available for the treatment of cancer, because it's a big problem here. It's a big problem in Africa. What facilities are there available?
Honestly, we've had facilities for treating cancer as far back as 1973. We've been treating cancer in Lagos here. The first real center to have cancer treatment equipment in West Africa. It was Lagos here. And up to today, we still have cancer equipment treating cancer. All we are seeing that we haven't got enough. Like here, we have just one machine in Lagos here. In fact, the machine broke down last July. It has just been repaired. UCH has one. Ahmadu Bello University has one. National Hospital Abuja has one. They will soon have the second one. Enugu has one. Benin has one. Sokoto has one. That's about all in Nigeria. Benin has one. That's about all in Nigeria.
How important is this machine?
The machine is very important because when you hear radiotherapy, the radio there actually means radiation. It's a radiation therapy. It is the use of ionizing radiation in treating cancer, in killing cancer cells. It is the most important instrument, the most important equipment for treating cancer. So it is absolutely important. Some hospitals have as many as 9, 10, 11, 12. The hospital where I trained in Europe, in Britain, before I left, many years ago, had 9 of such machines.
And here you have just one?
We have just one. And I told you, it broke down last July. It just been repaired. So that means between then and now, we didn't treat anybody because we had no facility. Honestly, I've always been saying this. At any point in time, any hospital with cancer treating facility should not have less than 2 treatment machines. So when one broke down, we shift the patients to the other machine. But leaving the cancer patients untreated for many months is a death sentence. In fact, it is. Indirect death sentence.
Do you get inundated by patients here? Is it the case that when you look at the number of patients that come here, would you say it's like the disease is becoming rampant in Nigeria?
It's been rampant in Nigeria for many years. In fact, the statistics show that as of now, there are 2 million cancer patients in Nigeria. And only 100,000 of them have access to radiotherapy machines, but they live near or close to where radiotherapy machines are available. 100,000 out of 2 million that have cancer presently. So in other words, the facilities are too few, too small. And in any case, even the personnel, because if you just buy the machine and there are no people to use it, it's useless. The personnel, trained personnel to use such machines are also few.
How serious is that problem, the problem of personnel?
The problem is very, very serious because, like I said, if you take the population of Nigeria as 160 million, and you have just about 6 machines in the whole country, functional machines, well, about 5 that are functional, that are really working now. Take 5, which is 5 to 160 million. That is one machine to how many millions? And there are cancer patients everywhere, including children, like I told you. So you can imagine how big the problem is. It's a mighty problem.
Overall, what do you think Nigeria, for instance, and in Africa, what do you think we need to do to fight this disease?
It's simple. Buy more equipment, enlarge the facilities, train more manpower. And honestly, in a discipline like this, where the manpower is very, very few, because we have just about 30 oncologists, radiation oncologists in Nigeria.
Just
30, just about 30. 30 to 160 million people. There should be some encouragement to those on the field now to encourage younger ones to come. Because one of the reasons why people don't come may be, one, the danger of radiation to self. Two, because radiation is dangerous to everybody. Two, it is not something you can go outside and practice on your own. The machines are very, very expensive. You can't go to private hospitals and practice. Because there's only one private hospital in Nigeria. That's a hospital that has a machine. So those who are in need should be encouraged. I don't know, like give them something. Hazard allowance to be greater than what you give to others, and encourage people to come.
So is it the case that younger ones are not like younger medical students and they're not showing interest in it?
They are not showing interest as much as they will show in other parts of medicine, because other parts of medicine may be a bit more lucrative. You can practice other parts of medicine anywhere you are, but radiotherapy you cannot. You will see the machine. The machine, and to use it, it's a special machine. It has to be in a special place. We call it bunker, because radiation must not leak out. Then the cost, about ₦1 billion to set it up. How many doctors can have such? And in any case, you cannot even overprice the patient, because it is not only the therapy the patient will have. The patient will also have chemotherapy. That is use of drugs, which is also very, 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 very expensive. So by the time, before the patient comes to you, he has spent virtually everything he has, because he doesn't believe in the orthodox medicine at the initial stage. He believes it is caused either by witchcraft, the other man or the other woman, the African sense of thinking. So before he comes to you, he has visited his church, his pastor, his babalawo, his everything, he's gone everywhere. So by the time you get him, it's almost too late. You get him in a very very, very late stage.
So you say most of the patients who come here, most times, they come here too late?
75% of patients we attend to nothing with cancer come in late stages. We call it stages 3 and 4. 75% of our patients.
How expensive is the treatment of cancer in Nigeria?
Well, it's not only in Nigeria. It's very expensive anywhere in the world and everywhere in the world, particularly chemotherapy. If a patient is in front of you now and he puts his drugs down, depending on the type of drugs he's using, depending on the type of cancer he has, depending on the type of part of the body he has the cancer, and depending on what the histology says, this type of cancer, this aggressive or this indolent, the drugs are may be as high as ₦1 million. And that will be every 3 weeks for 1 year or over. How many Nigerians can afford drugs? ₦1 million every 3 weeks for a whole year. How many Nigerians?
Quite a few.
That is chemotherapy. Radiotherapy is there. It may be as high as ₦100,000 or ₦150,000. Other supportive therapy, like blood transfusion, painkiller, that's painkilling tablets, admission, and whatever. And don't forget, surgery may be there. Surgical procedure, it costs money. Admission, the ward, and all that. So people can't really afford the money for cancer treatment. Even abroad, in the US, it's your insurance, health insurance. In the UK, it's NHS. Here we have our own NHIS. But NHIS is not covering cancer. It's so not covering cancer.
Just left on your own.
So where you are your own, on your own, or maybe what's called cost sharing. Members of the family, members of your church, your friends, everybody contribute to keep you for as long as they can until they feel tired. And everybody backs out.
Finally, let me ask you, most of the cases you get here, what kind of cancer are there?
Like I said, the common cancer here and everywhere in the world is cancer of the female breast. Cancer of the female breast. It's not that men cannot have cancer of the breast. Men also have cancer of the breast. We have cancers. We have breast. And men can also have cancer and reduce it. But by the time a man has, at least 100 women have had cancer of the breast. So that is one. Then, cancer of the female, where a man doesn't have the cervix, of the cervix. The cervix is the neck of the womb in the woman. Cancer of the cervix is one. Cancer of the prostate in men. Cancer of the GIT, gastrointestinal tract, that's your intestine. Okay. Cancers of the head and neck.
What can we do to avoid cancer? What would be your advice?
Honestly, I don't think we can ever avoid cancer again. But having said that, we always talk about early detection and early treatment. If you detect cancer early and treat early, the chances of survival are very, very high. If you come late with cancer, late presentation to the doctor, the chances of survival are very, very slim. In fact, the patient may not survive, and that is the truth. It sounds odd, it sounds bad, but that is the truth. So the most important is early detection, early treatment, early management. Because to prevent cancer, absolutely, maybe for early detection, we should know certain things. If you notice any lump or any thickening in any part of your body, your breast, your lip, your tongue, any part of the body, see your doctor. If you bleed through any orifice in the body, natural orifice, that's natural hole in the body, like your nostril, your mouth, your ears, your anus, the front passage in the women, anything, see your doctor. If you are losing weight, you don't know why. Losing weight is not intentional. People are just saying you are losing weight, see your doctor. Let them try to find out why you are losing weight. If you are losing your voice, see your doctor. There must be a reason for it. If you are up to 40 and above, and there's a change in your bowel habit, I used to go to the toilet once a day, I'm not going twice, I'm not going 2, 3, 4, 5 days or whatever, change in bowel habit, see your doctor. There's something somewhere. If you observe the sole of your foot and you see a black spot there, it's not painful, but it's there, it's permanent. See your doctor. It may be a particular cancer we call malignant melanoma, the cancer of the skin, but it's very deadly. Anything unusual that you notice, please see your doctor. Let your doctor tell you what it may be. So what you are saying, we used to tell women also, palpate your breast. That means examine your breast. You wash yourself every day. You rub creams on your body every day. Why not spend 2 minutes to examine your breast? Some people will say, well, 5 days after your menses and your breast, it's okay. But why not every day? How long does it take to feel your breast? Or press, if any fluid comes out through the nipple, what the color of the fluid? See your doctor and explain. Particularly, if that fluid that comes through the nipple is bloody, it may be indicative of cancer. So all we are saying is self-examination, self-awareness. For a man, 50 and above, we used to say, do your PSA. Even your doctor, I say, I can do a simple digital rectal examination. Stick a finger into your rectum and see what is there. But PSA is prostate specific antigen. It may have a story to tell, because the prostate is there in the man. It's very common, almost as common as cancer of the breast in females. So self-awareness is the
All right,